I think there's a couple considerations that people need to be aware of. So we're 3+ years into this outbreak of avian influenza, and it continues to spread in all kinds of different directions, including now dairy cows. And unfortunately, it's starting to produce some infections in humans also. So I think there's an issue with access. From an economic perspective, egg prices are hitting historic highs. Access to California is a major dairy state, and we've had over 600 dairy facilities affected by this, out of 1,000+ dairies. So there is a pocketbook issue that people will be, I think, affected by. But I also think it's important for us, as this virus continues to evolve, for us to be aware that we are starting to see some human infections also, and we need to be aware of that and prepare for that. And part of that is taking common sense measures. So things like making sure if we're around backyard poultry, for example, we wash our hands, we don't touch our eyes. I think the consumption of raw dairy products at this point in time in California is a pretty dangerous thing for various reasons. But I think we need to be very cautious as this continues to play out. Majority of cases have been occupational, so people that work around dairies and some poultry facilities to a lesser extent. There are a handful of cases that are slightly unexplainable at this point. Those are concerning, but I think we still need to understand specifically potentially how those people were exposed. The worst case scenario is that the virus eventually not only infects humans, but that we start seeing human-to-human transmission. I don't think we have any demonstrated cases of that yet, but it's important that we're aware that that's certainly a potential scenario that we need to plan for. And one of the ways we can plan for that is by making sure that we have a good surveillance system, we have a good public health system, and that we're testing people at risk, including dairy workers. Because the worst case scenario, one scenario you can imagine, is dairy workers get infected, they come home, they infect family members, and then so on and so forth. And we're dealing with ultimately a virus that has the potential to be a respiratory virus in humans and spread in that manner, unfortunately. There have been for the most part, the clinical signs have been mild. So conjunctivitis, like eye infections, things that are relatively mild. There have been a few people now. There's a teenager in British Columbia and now a case in Louisiana where people have actually been hospitalized. So we know historically other H5N1 highly pathogenic avian influenzas have caused high mortality, for example, in Southeast Asia. This one, not so much yet, but it's the same virus and the same group of viruses, avian influenza viruses that are part of this H5N1 family. So there's definitely precedent that the virus has the potential to be highly infectious and just as importantly, cause high mortality. We're just not there yet, but there was a recent publication from a group in San Diego, I believe, published in Nature that suggested we're one mutation away in this one protein from the virus being more infectious to humans, unfortunately. So we're 3+ years into this, and we are at this is historic what's going on. In 7,000 years of animal agriculture that we've domesticated animals for food animal production, we've never had anything like this. Geography, it's on 6 of 7 continents, species affected, whether they're wild birds, wild mammals, or domesticated birds and domesticated mammals. We're even seeing it in human wastewater now. So this is unprecedented. As far as why we haven't been able to control it, my own feeling is that we've spent billions of dollars on what to do after an outbreak. So a farm gets affected, We depopulate or euthanize the birds there to prevent further spread of the virus. We clean and disinfect the barns, and then we indemnify or pay back farmers so they don't go bankrupt. Those are all good things, but the reality is that's money spent after an infection, and we're spending billions of dollars on that, and we're not spending any money on the preventative side on how to give farmers information to identify which of their facilities. We have 44,000 commercial poultry farms in the US, 20,000 dairies. We need to give them information on which ones are at risk and when they're at risk. And we're not doing that yet. So there's a lot of stuff on the front end we need to invest in order, in my opinion, to give farmers a fighting chance to protect their herds and their flocks. There is a California, we're very fortunate. We have a sick bird hotline that people can call, and the California Department of Food and Agriculture can make a decision on whether they want to collect that bird and sample it and have that knowledge of where virus is. We need that kind of surveillance in the sense that we need to understand where the virus is, and that gives us some sense from an epidemiological perspective, where the virus is presently affecting different species, almost in as close to real time as possible. That's valuable information. The most important part, though, is that people protect themselves. So they need to make sure if there are dead birds, domestic or wild, that you assume that you're dealing with something that's zoonotic, that it can affect you and I, whether it's salmonella or avian influenza or something else. So we need to handle those animals very carefully and using gloves and masks. One of the things I now tell people, unfortunately, is that if you do have backyard poultry, I think it's really important for people to start wearing masks, in part because poultry, obviously, chickens have wings, and when they're flapping around, they're creating aerosols, and those particles can contain, among other things, viruses. And there's just so much virus in the environment right now that I think it's important, in addition to wearing boots and clothing dedicated to your backyard poultry. But I think it's also important to start wearing masks, unfortunately, just to make sure that we're not inhaling anything infectious. Waterfowl, which are ducks and geese, which are the primary reservoir, are migratory. So they can move hundreds of kilometers every day. So I always have to kind of remind farmers a little, your farm doesn't change location, but the risk does change based on environmental conditions, rain, things like that. What crops are growing around you? For example, corn and rice fields, flooded rice fields will attract waterfowl. Ponds will attract waterfowl. So waterfowl are bad. We need them. They're actually very important to our environment. But ultimately, in my opinion, the solutions that we really need to think about in the medium to long term, and we need to get started thinking about them now, are how we can geographically separate as best as possible where we grow our poultry, where we grow our dairy, and where we provide habitat for wild waterfowl. We have 6 million waterfowl in the Central Valley of California right now. We also have millions of poultry and probably hundreds of thousands of dairy cows. We need to put some thought, and we haven't really done this historically, on that relationship between those wild animals and these domesticated animals that we are so dependent on for our food. And we just haven't done that, and we probably need to get started sooner than later on how to do that. And there's ways to do that. We can do that, but it's going to take some time, and more importantly, it's going to take a different thought process among various stakeholders. The biggest thing I try to remind people is that if they have backyard birds, they just need to be cautious. Like I work with a lot of backyard chicken farmers, and they're very passionate about what they do. Some of them, they let their birds in the house, or they get, very close in contact with those birds. And, this is just another reason we need to be cautious about that. The other thing I'd really suggest, I know, some people are very passionate about raw milk. We can agree to disagree on that issue, but I would, it's in my opinion that is a very dangerous product at this point. We don't do enough surveillance of it to really have it to be confident that there's not virus in the product when it's going for retail sales. And we know affected farms, dairies, have had feral cats that have died from consumption of raw milk. So, in my opinion, when cats are dying from drinking raw milk, they're mammals, we're mammals. There's more similarities and differences, and I'm concerned that's a potential risky way for not only people that consume that product to get sick, but maybe there's scenarios where the virus can further spread from there. We have so much virus in so many different environments and so many different species. We're really playing with fire the more that we have virus and humans interacting with each other.